Imagine if one of the most important organs in your body was slowly becoming damaged. And you had no idea. Right now, your liver is working tirelessly behind the scenes. Every minute of every day, it filters harmful substances from your blood, helps digest the food you eat, stores essential vitamins, balances your body's energy, and supports more than 500 vital functions that keep you alive. Your liver is incredibly resilient. It can keep working even when it's under stress, which is exactly why liver disease often goes unnoticed. In many cases, it develops silently without obvious symptoms in its early stages. By the time clear warning signs appear, the damage may already be significant. So how do you know when your liver might be asking for help? In today's video, we'll cover 5 warning signs your liver may be sending you, what they could mean, and simple habits to help protect your liver. Stay until the end for practical liver health tips. Let's get started. Welcome to Cerevora Wellness, your trusted source for evidence-based information on disease prevention, nutrition, healthy aging, and living well. This video is for educational purposes only. The symptoms discussed can have many causes and don't necessarily mean you have liver disease. Only a healthcare professional can diagnose liver disease. Our goal is to help you recognize possible warning signs and know when to seek medical advice. Now, let's begin with the first warning sign. Everyone feels tired occasionally. Maybe you've had a long day at work, stayed up too late, or simply haven't been getting enough sleep. But imagine waking up after a full night's rest and still feeling completely exhausted. Persistent fatigue is one of the most common symptoms reported by people living with chronic liver disease. When liver function becomes impaired, the body's metabolism can be affected, leading to ongoing tiredness. However, fatigue is also one of the least specific symptoms in medicine. But if your tiredness is severe, lasts for weeks, or interferes with your daily life, it's worth discussing with your healthcare provider. The next warning sign is much more noticeable and should never be ignored. Imagine looking in the mirror one morning and noticing that the whites of your eyes no longer look white. This condition is known as jaundice, and it's one of the most recognizable warning signs that something may be affecting your liver or bile ducts. Here's why it happens. Every day, your body breaks down old red blood cells. This process produces a yellow pigment called bilirubin. Normally, your liver processes bilirubin and helps remove it from your body through bile. Jaundice is also a symptom, not a disease. It can be caused by liver diseases such as hepatitis or cirrhosis, blockages in the bile ducts like gallstones. If you or someone you know develops jaundice, don't ignore it. It's a sign that deserves prompt medical evaluation to identify the underlying cause. What if your liver is enlarged or inflamed, but there's no yellow skin to warn you? Sometimes your body sends a different signal. However, if it becomes enlarged or inflamed, it can stretch the thin capsule surrounding it, creating discomfort or a feeling of pressure. It's important to know that this type of discomfort isn't unique to liver disease. Many people with early fatty liver disease experience no pain at all. That's one reason regular checkups and healthy lifestyle habits are so important. If pain in the upper right abdomen is severe, persistent, or occurs alongside fever, vomiting, yellowing of the skin or eyes, or unexplained weight loss, seek medical care promptly. Your body may be telling you something that shouldn't wait. So far, we've covered 3 possible warning signs that may indicate your liver needs medical attention. But the next signs are even easier to overlook because many people mistake them for everyday problems. Here's a question most people never think to ask. Could a trip to the bathroom reveal something important about your liver? Most of us don't pay much attention to the color of our urine or stool unless something looks very unusual. But changes in these can occasionally provide valuable clues about what's happening inside the body. Let's start with urine. If you've exercised heavily or haven't had enough water, your urine may become darker than usual because you're dehydrated. But if your urine stays unusually dark, even when you're drinking enough fluids, it's worth paying attention. One possible reason is a buildup of bilirubin, a yellow pigment that your liver normally processes and removes from your body. Now let's talk about stool. Healthy stool is usually brown because of bile, a digestive fluid produced by the liver and stored in the gallbladder. If bile isn't reaching your intestines properly, your stool may become pale, gray, or clay-colored. These changes don't always mean you have liver disease. Certain medications, digestive conditions, and other medical problems can also affect urine or stool color. However, if dark urine or pale stools occur together with yellowing of the eyes, abdominal pain, fever, or persistent fatigue, it's important to seek medical attention promptly. Sometimes, small changes can be your body's way of asking you not to ignore a bigger problem. But what if your skin is driving you crazy? Even though there's no rash? That brings us to the fifth warning sign. Have you ever experienced an itch that just wouldn't go away? You try different creams and moisturizers, but the itching never seems to go away. For some people with liver disease, this can happen because substances that are normally removed by the liver begin building up in the bloodstream. Many people assume the problem is dry skin or an allergy and continue treating it at home without realizing there may be another underlying cause. If persistent itching occurs with jaundice, dark urine, or fatigue, see a healthcare professional. Early evaluation can help identify the underlying cause. We've now covered the 5 possible warning signs. Now you may be wondering, who is more likely to develop liver disease? Common risk factors include being overweight, having type 2 diabetes or high cholesterol, drinking excessive alcohol, chronic hepatitis B or C infection, a family history of liver disease, and improper use of certain medications or herbal supplements. Having one or more of these risk factors doesn't mean you'll develop liver disease. It simply means regular checkups and healthy lifestyle habits are especially important. Having one or more of these risk factors doesn't mean you'll definitely develop liver disease. The good news is that many liver conditions can be prevented or their progression slowed through healthy lifestyle choices. Here are 5 habits that support overall liver health. Number 1, maintain a healthy weight. Number 2, eat a balanced diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats while limiting sugary drinks and highly processed foods. Number 3, stay physically active. Aim for at least 150 minutes of moderate physical activity each week. Number 4, limit alcohol consumption or avoid it completely if your healthcare provider recommends it. And number 5, use medications and supplements responsibly by following recommended doses and discussing herbal products with your healthcare provider. The encouraging news is that many liver conditions respond better when they're recognized early and managed with appropriate medical care and healthy lifestyle changes. If you found this video helpful, please like, subscribe to Cerevora Wellness, and turn on notifications for more evidence-based health content every week. Which warning signs surprised you the most? Let us know in the comments below.